Hi, welcome to another episode of Medical News of the Week. And like last week, I have my very good friend and producer, Shannon, here to help us out. So, Shannon is going to ask me about the news of the week. As last time, I haven't had access to the questions, so I'm going to hear them for the first time, like you do. But she's scoured the internet and scoured all the medical and news website, and she's come up with some good questions, hopefully for me. So without any further ado, Shannon, take it away. Say hello and take it away.
Thank you so much, Dr. Baktari. All right, so I think we've got some good questions here. Last week you nailed every single one. Let's see if we can do it
Oh,
again this week.
obviously she works for me, right? So to speak. Thank you for saying that.
Absolutely. Okay, so the first thing. So, in a sign that the highly contagious Omicron variant is sparing no one, a new report shows that new COVID 19 cases among U.S. children spiked to a high of more than 580,000 for the week ending January 6th, a 78% increase from the week before. So, what
Mhm.
factors are at play here to account for this growth in a previously more or less unaffected portion of the population?
Yeah. Well, number one, I think we know the Omicron is more contagious, so that's pretty clear. And clearly, that the children are definitely in a subgroup that are not do not have the same vaccination rates as the adult population. So obviously, it's going to have a disproportionate impact on the unvaccinated population, including children. So that's not really a surprise. And of course, children, have not, a lot of children in terms of social distancing, mask wearing, or it's just not a thing at a certain age. So put all that together, and that's not a big surprise.
So, Pfizer Inc. said Tuesday that a COVID 19 vaccine that specifically targets the Omicron variant will be ready by March. And I think you mentioned this in the last
Aha. Yes.
episode.
What do you make of that? See?
Yes.
Yeah. Well, we know that because we know that about mRNA technology. Literally, a new version can be produced in terms of getting from the time they get the sequence of any variant to the time they can essentially make the RNA vaccine can be just days, then getting into production, whatever. So the amazing thing about mRNA technology is once you get the genetic sequence of any variant, it's literally could be days until a new candidate is created. Now, how long it takes that candidate to get into production and then get it out. But I can tell you this, I could only imagine that the last, 12 to 18 months, both Pfizer and Moderna have ramped up their production capabilities. So I think, unlike the first version, I would imagine the second version uh, is going to be much quicker. And then we talked about that last week, the new version coming out, and should it have come out already with Delta? Maybe. We talked about, if you want to link that last week video, but sort of COVID vaccine fatigue. I just saw a very cute thing. Someone sent me a mime where somebody had a shirt and it had a pocket that opened so you could get your next COVID shot. That that speaks to the sort of like, oh my gosh, another COVID vaccine. But yeah, it's indicated probably, and we're probably going to see it for Omicron, and if there is another variant, yeah, it's going to be included. I think it's pretty clear that reaching herd immunity, with the older variants, when newer variants are coming out, is going to be difficult. So I think it's going to be endemic, like we've talked about in other videos, and I think we're going to have to come up with a long-term solution.
Yeah, that's pretty incredible with the technology. I mean, just days to get that turned around. So basically, we can kind of expect this game of variant cat and mouse, so to speak, to continue
Yeah.
well into the future at this point.
Well, maybe, yeah. People kind of compare it to like a whack-a-mole. Like you get a vaccine for this virus and another. But the way I kind of look at it, more, instead of thinking of it like that, just think of it as a yearly shot to cover, and we were okay with that with the flu, right? Nobody really complained that much. So I think maybe what we're missing is that sort of just, periodic, where everyone expects a new vaccine to come out and is mentally and emotionally ready for it. So maybe at the same time as the flu shot, that would be ideal. So you don't have to get people into the office in September for a flu shot and cajole them to come into the office in February for a COVID shot. So I would imagine long term, from a public health point of view, it would be ideal if we could get both of them into one visit, one shot even, at one time of the year. And I think, if we get through this winter season, I could for sure see something happening in early fall for a vaccine that covered all the most common variants.
Yeah, that would be fantastic and probably get those vaccine numbers up even more.
Yeah.
Okay, so next question. The new annual index measures changes in healthcare access, jobs, and spending over time. As healthcare enters an unprecedented change in the way people are covered, how care is paid for, and how it's delivered, we want to better understand how it affects things like jobs and people's economic well-being. So besides a rise in spending, what other forms of long-lasting change has COVID-19 forced us to take a look at as a society when it comes to how we operate our everyday healthcare system?
So you're asking me, how has COVID impacted healthcare and the changes that it's caused?
Absolutely, yes.
Yeah, COVID is an accelerator. If there was a certain department store that was going to go out of business in 10 years or 5 years, if their business model was whatever, to me, COVID accelerated a lot of the stuff. But it also accelerated changes in healthcare. And I think one of the changes in healthcare, which we've talked about on the show before, is, the push for telemedicine, telehealth, and this ability to get healthcare served up in different ways. We saw, for example, in a time of crisis, we saw the monoclonal antibodies given in clinics and parking lots, with tents and what have you. I think this ability to be mobile and have telemedicine involved, where, the ability for patients to access healthcare, could be as easy as going on their cell phone or going on a computer. And I think the other thing that COVID-19 showed us is this: we really need more points of light in the healthcare system. Just having a couple of pharmacies and some doctor's offices in a community may not be enough. And we need to, reimagine how we deliver healthcare, whether it's more mobile, more clinics that can pop up and move around based on need, is some of the changes we've seen, and it's probably some of that is here to stay permanently.
Yeah, I've definitely noticed driving around town, these pop-up clinics that you say, or even in RVs in fifth wheels on the side of the road, you can get tested for COVID. Very interesting.
And before that, it was very difficult to pull that off. There was regulations, and there was other things that had made you jump through a lot of hoops to pull that off. And even telemedicine, was, across state lines, there was issues with getting reimbursements from third parties. So a lot of that has gotten much better.
Fantastic. All right, well, let's move away from COVID for a little bit here. I'm not sure if you've heard about the Pig Heart Recipient continues to recover from a transplant. So there was a man who received the first pig heart transplant, and he's continued to recover from the experimental surgery. What are your thoughts on the brave new world of medicine as more of these types of unprecedented operations are taking place?
Yeah, I did see that in the news, and I think, that really speaks to, pushing the envelope. Obviously, we know, especially with certain transplants, there's just simply not enough donors to go around for the number of people who need it. And I think, coming up with creative ways to provide, donor organs to patients who need it, especially, like heart transplants, I mean, if there was a way we could really get that to work, there's a lot of people who are on waiting lists who desperately need the alternatives. So, yeah, it's a brave new world, and hopefully that goes smoothly and they can get all the kinks out of it, and it can be a true alternative.
Yeah, we'll keep an eye on that one.
Okay.
Okay, so a more serious topic here. Red Cross says that the U.S. blood supply is at a dangerously low level. Part of the scarcity may be a result in people's reluctance to go out less frequently these days. But from your clinical experience, can you give us some insight to just how dire the situation is for doctors and healthcare professionals?
Yeah, so we've had shortages of donors and for transfusions that are needed in the medical world. And people have to understand a lot of those transfusions are really needed in dire circumstances, whether it's trauma patients, whether it's surgeries that require transfusions. So what happens is when the supply of blood gets less and less, there's more triaging that goes out. And also remember, from this blood, we make other products like plasma and platelets and what have you, which are needed for specific diseases. So it just makes life so much more difficult because doctors occasionally have to triage people and see who needs them the most critically. So yeah, I really want to encourage everyone, if they're healthy and they're able to donate, and literally you can save lives. It's a very easy thing to do. Just go to a donation center. You get plugged up with an IV. It really is pretty harmless. You just lie on a couch or a lazy boy, and it's over in no time. I really encourage people to do that. You can really save lives. And this shortage is real. Still, I think the shortage has not been this bad in over a decade. And we have these periodic shortages, but when it happens this bad, it really needs people to take action. So thanks for bringing that up.
Absolutely. Well, that's all we have for you today, Dr. Baktari.
Wow.
Thank you so much.
Thank you, Shannon. Thanks for all those great questions. If you like this content, please like and subscribe. If you want to put some comments below, we'll try to address them too. Thank you, and be well.